Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
In today's session, we're going to explore one of medicine's most fundamental tools, the electrocardiogram. We're going to learn how to read the incredibly detailed electrical story the heart tells us, beat by beat. So that really is the core question, isn't it? The heart communicates in this language of electricity. It's like a silent story of its own health and function. And our job is to learn how to read that story, just by looking at what's happening on the surface of the skin. All right, so to start, we really have to get our heads around one basic idea. The heart is, at its very core, an electrical organ. Every single contraction, every pump of blood, it all starts with and is controlled by a very precise wave of electrical current. And the process we use to listen in on this activity is called electrocardiography, or as you probably know it, ECG. What's so amazing about it is that it's completely non-invasive. It lets us capture the sum total of all that electrical activity from every muscle fiber in the heart. It really gives us this incredible window into how the heart is working without ever having to go inside the body. Okay, so how does this actually work? Well, as this wave of electrical activation, what we call depolarization, sweeps across the heart muscle, it creates a separation of charge. You can think of it like this. For a brief moment, the heart itself becomes a tiny electrical dipole, kind of like a little battery with a positive and a negative pole. And it's that electrical field it generates that we're able to pick up with electrodes placed right on the skin. So that begs the question, right? How do we capture what is actually a pretty faint electrical field? Well, the answer lies in a system of electrodes and leads. Let's take a look at how these pieces come together to give us the full story. Now, this is a really important concept to grasp. The best way to think about each lead is as a unique camera. Each one is pointed at the heart, but from a slightly different angle. So we're not looking at a bunch of different things happening. No, we're looking at the exact same electrical event, just from multiple viewpoints. And by doing that, we can build a complete, almost three-dimensional picture of what's going on. And the key here is how these different camera views are organized. You've got the limb leads, the ones we place on the arms and legs, and they give us what's called a frontal view of the heart's activity. It's as if you're looking straight at the person. Then you have the chest leads, which go right over the heart, and they give us a horizontal or transverse view. You put those two sets of cameras together, and suddenly you have a really comprehensive 3D understanding of the heart's electrical patterns. Okay, so we've set up our cameras and we've captured the signal from all these different angles. Now what? Well, all that information gets translated into a waveform. And this waveform isn't just random squiggles, it has a very specific structure. You could even call it an alphabet that we can learn to read. All right, let's zoom in on what a classic ECG tracing looks like. Every little bump, every spike, every wave you see, it represents a very specific moment in the heart's cycle. And you'll notice there are three main parts that stand out. There's a P wave, a QRS complex, and a T wave. So let's break down what each of these components is actually telling us. First up, you have the P wave. That's that first small rounded bump. It represents the electrical activation, the depolarization of the atria, which are the heart's two upper chambers. Then, boom, you get this big, sharp spike. That's the QRS complex. It's so much bigger because it represents the depolarization of the much more muscular ventricles. And finally, you see the T wave. This wave shows the ventricles electrically resetting themselves, repolarizing, so they can get ready for the very next heartbeat. Now, it's not just about the shape of these waves. The timing between them is absolutely critical. These gaps, these intervals, they tell us a story about how fast and how efficiently that electrical signal is making its way through the heart's special conduction pathways. Let's look at some of these key time measurements. Take the PR interval, for instance. That measures how long it takes for the electrical impulse to travel from the atria down to the ventricles. If that journey takes too long, well, that can be a sign of a block somewhere in the path. Then you've got the QRS duration. This tells you how quickly the ventricles themselves are activating. And finally, the QT interval. This one is really important. It represents the total time for all of the ventricular electrical activity. That includes both the depolarization, or the contraction, and the repolarization, the reset. Okay, let's shift gears now to a slightly more advanced concept. By taking all the information we get from our different cameras, our multiple leads, we can actually figure out the overall, or average direction of the heart's electrical energy. And we call this the electrical axis. So, what is that exactly? Well, the mean electrical axis, or MEA, basically boils everything down to a single arrow. It shows us the dominant average direction that electricity is flowing as it moves through the ventricles. I like to think of it as the heart's electrical center of gravity during that phase. So, you might be wondering, how do we actually figure this out? Well, this is where those 6 limb leads come back into play. We combine their viewpoints to create this 360-degree map of the heart's frontal plane. It's a system known as the hexaaxial reference system. And by looking very closely at the QRS complex from each of these angles, we can pinpoint the mean electrical axis with incredible precision. But why does this even matter? What's the point? Well, it's hugely important because the direction of that axis can give us some major clues about the underlying health and condition of the heart muscle itself. You see, in a healthy adult, the electrical axis normally points down and to the left. It falls within a specific range, usually between about -30 degrees and +120 degrees. When we see a significant shift outside of that normal range, we call it an axis deviation. And that deviation is a big red flag that something might be changing the heart structure or how it's functioning. For example, if the axis shifts far to the left, what we call a left axis deviation, it could be a sign that the left ventricle muscle has gotten too big or hypertrophied. This is something you often see with long-term high blood pressure. On the flip side, if the axis shifts to the right, a right axis deviation, that might point to hypertrophy of the right ventricle, which can happen with conditions like chronic lung disease that put extra strain on that side of the heart. So when you really think about it, the electrocardiogram is so much more than just a medical test. It's a translation. It takes the heart's fundamental electrical nature and turns it into a visual language, a story about its health, the strain it might be under, and any disease present. And as we get better and better at reading and interpreting this incredibly detailed language, it leaves you wondering, what other secrets is the heart just waiting to tell us?